Yoga as Therapy for Back Care, Part 3. From Child's Pose, inhale up to hands and knees or table. Draw your shoulders back, looking up. And then exhale back to Child's Pose, bending your elbows out to the sides. Inhale up. Shoulders back, heart forward, coming into a little bit of a back bend. Exhale into Child's Pose, coming into a forward fold. Inhale up. And this time, curl your toes under and exhale to Downward Facing Dog. Keep your knees bent here and separate your shoulders from each other, drawing your shoulder blades down your back. Let your head be heavy. So don't worry about straightening those legs. If you straighten them too soon, then you can pull on your pelvis and injure your lower back. From Downward Facing Dog, come back to table, shoulders back, heart forward. Exhale to Child's Pose. Inhale to table. Exhale, Downward Facing Dog. Inhale to table. Exhale, Child's Pose. Inhale, up to hands and knees. Curl your toes under. Exhale to Downward Facing Dog. Stay here. Again, separate those shoulder blades. Move your shoulders away from your ears. Let your head be heavy. And then you can walk one heel back at a time to warm up those hamstrings. Don't compromise your neck and shoulders here. And then come up on your toes, bend your knees, push into your hands, lift your sits bones away from your hands as far as possible. And on an exhalation, slowly lower your heels towards the mat, only as far as they can go comfortably. Push equally into your hands and feet and breathe slowly and deeply. And on an inhalation, shift forward to plank. Draw your belly in, your shoulders down your back. As you exhale, come back to down dog. Inhale to plank. Exhale, down dog. Inhale to plank and hold. If you need to, lower the knees and breathe here. The intention is that you're strengthening all your core muscles, including your back. You're also strengthening your arms. And then from here, we're going to come back to Downward Facing Dog. Inhale to hands and knees. And exhale to Child's Pose. Breathe into your back, noticing the effects of your practice. Notice your wrists. Maybe you want to rotate your wrists a little to release any tension in them. Switch directions. And on an inhalation, come up to hands and knees. Draw your shoulder blades down your back, engage your core. On an inhalation, extend your right leg out behind you, pushing through the mounds of the toes. Make sure you don't pop that right hip way up. You want your pelvis to be level. And on an exhalation, draw your knee and your forehead towards each other. Inhale, stretch that leg out behind you. Exhale, squeeze it in. Stretch it out. Exhale, bring that foot up between your hands or to the outside of your right hand. The important thing is that the knee is over your ankle. You want to draw the shoulders down, lengthen your spine, feeling the stretch in your inner left groin. Inhale here. As you exhale, pull your hips back, lifting the right toes. Inhale forward. Exhale back. Inhale forward. Exhale back. Hold the stretch. Keep your spine long, breathing deeply, noticing those right hamstrings and calf muscles. You can point and flex the foot, working on increasing mobility in your ankle and your foot. Bring your toes to the mat, rock your foot from side to side. And then shift forward to that low lunge. We're stretching your hip flexors in the front of this left hip, and those are really important for the health of your lower back because when they're tight, they can pull your pelvis out of alignment, which pulls on your back. So breathing deeply here, you can either stay here or you can lift your torso up, resting your hands on your thigh. You don't want to hold here to support yourself though. You want to have a firm core, a tall spine. You can stay here, or you can inhale and sweep your arms up, lengthening your spine on the inhalation, softening and relaxing your tailbone towards the earth as you exhale. Equal effort and ease. And on an exhalation, dive down. Stretch that right leg back out behind you. And lower it next to the left knee. Inhale and exhale to child's pose. You can rock your hips here. Notice how your hips feel. They should feel different than each other since we just worked a lot on one and not the other. Use your breath to slow down your heart rate, to slow down your brain waves. Slow, deep, fluid breaths. And on your next inhalation, come back up to hands and knees. Draw the belly in, shoulder blades move down your back. On an inhalation, stretch your left leg out behind you. On an exhalation, draw your knee and your forehead towards each other. Inhale, stretch that leg out. Exhale, squeeze it in. Inhale, stretch it out. Exhale, bring that foot up between your hands or to the outside of your hand. Check that your knee is directly above your ankle. You want to feel the stretch in your inner right groin. Lengthen your spine. Inhale here. As you exhale, pull your hips back, lifting your left toes. Inhale forward. Exhale back. And exhale back. Hold the stretch. Lengthen your spine. Look down and check that your right hip stays over the knee. You don't want to push way out to one side. You want to keep your pelvis level, squared to the front of the mat. And then you can point and flex that left foot. Bring your toes to the mat. Rock your foot from side to side. And then shift forward for the low lunge. Again, either stay here or rise up, drawing your lower belly in, lifting the chest. Inhale, sweep your arms up, shoulder blades slide down your back. Inhale all the way up your spine, up your arms, out your fingertips. Exhale down your spine into the earth as you relax a little bit more with each exhalation. And on your next exhalation, dive back down. Stretch your left leg out behind you. And bring that knee down. This time separate your knees to the edges of the mat, big toes together, and exhale to wide-kneed child's pose. Let your forehead relax. Bend your elbows out to the side so your shoulders relax. And breathe into your lower back and your hips. Find the tension. Exhale, breathe it out. Letting it go. And inhale up to hands and knees. Walk your knees forward, cross your ankles. We're going to come onto our backs. Coming back to constructive rest. In this position, your spine is decompressed. You want to check that you have that arch in your lower back. And feel the weight of your femur bones pulling down, pushing into the hip socket. So the head of that femur is in the hip socket, and you want to feel gravity just pulling it down there so that those hip joints can completely relax. And rock your hips from side to side, noticing your pelvis, where your pelvis is in space. Become aware of your spine, where it's touching the earth, at your sacrum, your upper back, and where it's not touching the earth, at your lower back and the back of your neck. Notice your breath and allow your breath to expand your entire torso in all directions. Bring your hands to your heart and reflect back on the intention you set for yourself at the beginning of practice, or you can set an intention now. An I am statement saying what you most want as if it were already true. And say it 3 times silently.